Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Hello, everybody. I'm Anita Finley, your host for this terrific potential interview that we're going to have with a wonderful doctor who's been practicing a long time. And I have a lot of questions to ask you, Dr. Kevin Underwood, because it's Inwood. Excuse me, Dr. Kevin Inwood. You are you're really interested in people, and I can see that from reading your vitae. And what I liked about it is when people go to see doctors nowadays, they complain that there's not a lot of conversation, but I can see that you're truly an interested person.
That's very kind to you. I try to make it a relationship where when patients come in, they're not just there for their healthcare needs or preventative care, but I also like to develop a relationship with them. So if I happen to see them out in public, we can actually have a nice conversation.
Well, that's very nice of you. That's right. So Dr. Kevin Inwood, let's talk a little bit about when you call yourself internal medicine, tell us what that actually means compared to other doctors.
So internal medicine is going to be primary care, but its focus is going to be adult medicine. So we see patients anywhere from 15, 16 years old, all the way up to our oldest living patient, which is she's just about to be 109 years old.
No way, 109?
Yes, and she is a pistol and she's doing fantastic and she's doing very well. But it basically incorporates all different types of disease entities for these adults, whether it's diabetes, hypertension, cholesterol management, and all those types of things. And it also includes a lot of preventative care. So we attempt to take certain patients on a daily basis, depending on age, and give them recommendations for prevention of disease, which would include, for example, cancers and that type of thing, including heart disease, et cetera. And then also on top of that, if they do happen to have a disease state, there's a lot of prevention and a lot of therapeutics that we utilize. For example, in diabetes, it helps prevent them from developing further complications with their disease process.
Excellent. So let's go back to the 109-year-old woman. So Healthy Partners must be doing a good job because 109 years old. I mean, we're not going to say who this is, but you must be so thrilled to have someone like that in your practice.
Yeah, I am. I will tell you, we get a lot of patients that come in that are over 90, and we have some that are approaching 100 and some that are in 100. But again, like I said, our oldest one is 109, and she's a little spitfire. And I like to see her every 3 months because I just want to make sure she's doing okay, because I just want to keep her alive as long as possible with a fine quality of life. And so far, she's doing well.
Oh, that's excellent. I know that makes you happy as a physician because you've been doing this since 1988, I see. And is that true?
That is correct.
So tell me about how medicine has changed since 1988 and how you treat people today.
So there's been a lot of issues with different types of problems with insurance companies and reimbursements and lots of different things that we're tying our hands as clinicians when most physicians that have gone into medicine just want to be able to treat patients. You also have to have some business savvy to run a practice and that type of thing. And what a lot of us have done over the years is we assimilate ourselves with other groups, or we have aligned ourselves with corporations that can run the practice and just give us the ability to maintain the practice of medicine. Knowing that, of course, if there's any issues that need to be addressed as part of working for a corporation, we have to be receptive to that. But our primary responsibility now, without having to worry about the business aspects per se, is the ability to treat and take care of patients, which makes me quite happy. And that's been a change over the last 33 years that I've been doing this.
So Dr. Inwood, when did you decide to become a doctor?
I decided when I was approximately 12 to 13 years old, when I broke my arm playing soccer in Miami at junior high school. And my father came and picked me up because he was a service technician. He would fix your appliances. He worked for General Electric. He picked me up, took me to the orthopedics office. And while I was sitting there with a broken arm, I looked up and I saw a mounted sailfish on the wall. And I wanted to catch a sailfish, and my dad told me I would not be able to do that because it's something that requires you to work very hard and make a very good living on. And I said, well, why does this person have it? He said, because he's a doctor and he can afford it. At the age of 12, 13 years old, I decided I wanted to become a physician so I can go catch a sailfish and put one on my wall. And sure enough, I never looked back. From 13 on, I never looked back.
And did you catch a sailfish?
I have caught more sailfish than you can ever imagine. And I have never killed one to mount it on the wall. I let them all go. But I did buy a mount that I saw at a boat show one time that was just a replica, and I put that on my wall at home.
Now, I have asked many physicians this question, and I think this is the best answer I have ever gotten. I'm just thrilled. Thank you for telling me that.
Thank you.
That's really great. So you're living out the life that you desired. So now let's get back into the medicine part of this. So let's see someone that comes in and they have high blood pressure or they have diabetes. How do you get them to adhere to your advice? That's always been my question.
Yes. So there are some patients who could be very resistant to advice, just like with anything else in life. It doesn't even have to be medicine, but it can be family members, it can be friends. But what I try to do is I try to explain to them in no uncertain terms the risk of what their disease entity has, can cause, including even death. So then what I do is we come up with a game plan, and I explain to them quite specifically that in all likelihood, there is no damage that has been done. So if you take care of it now, that really does make a difference. I try to talk to them about everything from exercise to diet to sodium restriction, and also our pharmacological interventions if needed, because a lot of patients who do really aggressively change their lifestyle do not require medications for hypertension or even diabetes. And of course, there's a certain percentage of patients that do, and we have to give them a complete plan. And a lot of them do stick with it. They really do.
Yeah, well, and I think once you have the relationship that I can see that you have with your patients, they're going to do that because they want to make you happy with them. And so that's wonderful. Now, but let's just talk about some of the things that you do ask them to do. So let's say someone does come in and they do have high blood pressure. What do you want them to do?
The most important thing is going to be what their lifestyle is. So if they're drinking a lot of caffeine, we want to cut back on caffeine. If they're drinking a lot of alcohol, we like them to cut back on alcohol. We don't tell them to stop because it's not realistic, but we give them a goal of cutting back and tapering down. Sodium restriction, weight loss. And depending on the levels of the blood pressure and depending on how they're able to do over a period of a couple of months, will determine whether or not they need to go on medications or take the pharmacological route, which we explain to them up front. And then we also talk about potential side effects with medications. But ultimately, medications may very well be required. And then, of course, once you initiate all their lifestyle changes, we call them therapeutic lifestyle changes. And once you have them on a medication protocol, which is appropriate for them, you want to make sure that the blood pressures have normalized and they do not develop any of the complications that are associated with long-standing hypertension.
Yeah, those are all wise words. Well, let me tell everybody, this show is being sponsored by Healthy Partners, where Dr. Inwood is a physician. And I love the title in their ad. It's called Healthcare That Feels Like Florida Sunshine. That's beautiful. And if you would like an appointment, I will tell you right now, here's the phone number. Get your pencil out, get a book, a little pad so you don't lose it. It's 561-418-6200. And I'll repeat that again, 561-418-6200. And they have many physicians there, but Dr. Inwood is a very special physician, and you can find out when you call, tell him you want to find out where he is because you want to go and see him. So Dr. Inwood, we've talked now about a few of the issues, but how about people who are aging, but they're aging well? And I always think that if you look at their diet, that says so much. So are you able to, do you tell them what they should be eating? Do you recommend certain supplements? How do you deal with that?
So one thing my grandmother, who has since passed, I've always heard when I was younger, was everything in moderation. So that would include everything from your diet to exercise, to alcohol consumption, to those types of things. So there are patients and there are people that I know that I believe drink excessively, or they may eat the wrong foods excessively. And I always explain to them that what is acceptable would be reasonable alcohol consumption. Also, if you go on a cruise or you go on a celebration or you're going on vacation, to enjoy yourself. Because whatever you do during that week or two is not going to change your lifestyle in regards to diet or alcohol. It's the long-term, everyday things that we do that can affect our overall health. So we try to educate patients by giving them reasonable expectations and goals. Like I said earlier, we don't want to cut everything out. We want to taper things down. And it's amazing how once patients do that, including an exercise program, once they start and they get into it, they can't stop doing it. They feel fantastic. And that is a good positive reinforcement that helps their overall health.
And so just going back to that 109-year-old patient that you have, I'm sure that, she doesn't do a lot of the bad things. And she wouldn't live to be 109. Otherwise, of course, good genes are important, but I'm sure that she has been very responsible with her health.
She has been, but when you hit around 90, 92 years old, I tell patients that whatever you're doing, I don't care if it's bad, don't change it. Because whatever you're doing has worked for you perfectly. And you are right, genetics does play a huge role. And unfortunately, there are some patients and some people who have bad genetics that can, lead to cancer and heart conditions. But what you want to do is you can change your genes, but you can mitigate the damage by changing your lifestyle. So you can change the other side of the coin by helping them improve and reduce their risk of having certain issues, because one side may be something that we cannot control.
Very, very good advice. And I wish everyone would listen to their physician. And so let's get down to what is probably of the elder population, is it diabetes that is the most difficult for them to handle, or what other disease?
Yeah, so diabetes is a very, very difficult disease to handle. And the reason for that is because it does require a lot of lifestyle changes, from diet restrictions to weight loss. And if you come as a diabetic, in regards to what the recommendations are from these different diabetic societies and certain organizations that determine what would be best as far as a standard of care, it requires significant interventional pharmacy. So if you come with diabetes, you're going to have to probably be on an ACE inhibitor to protect the kidneys. You're probably going to have to be on a cholesterol medication, even if your cholesterol is normal, because they want to get your level down to subnormal in order to reduce the risk of developing cerebral vascular disease or stroke or cardiovascular disease. And then you also may have to be on diabetic medications. They can be some types of injections, which, by the way, the injections are so easy now, it's almost ridiculous. Some of the injections help promote weight loss in addition to controlling the sugars. You also have to follow with an eye doctor, a foot doctor. So there's a lot of things that have to be done once you're diagnosed with diabetes. The most important thing for diabetes is not to get there, or if you begin to go into what we call impaired glucose tolerance, which is pre-diabetes, hit it full force and get it back to where it was normal before you have to go into that whole realm of treatment that I just mentioned.
That's really something. So if you can help them prevent diabetes, of course, that's the key. What other diseases are you're very involved in? I see your list, of course, cardiology and all, but besides diabetes, what would it be?
So hypertension is probably the most common thing that we see. And the problem with hypertension is that patients don't realize that it really is truly the silent killer. So over a period of years of having high blood pressure, it can put a significant strain on your heart and your blood vessels that come off the heart and also supply your brain. And that can lead to premature strokes and heart attacks. So getting blood pressure under control is extremely important. And the problem with that is, you have your numbers that you can say, I want you below, let's say, for example, 120/80. But the problem is that if it's not, patients most of the time don't feel any difference. So they think it's kind of okay, but it's not okay. Whereas with other medical conditions, you begin to feel kind of lousy. So therefore you do try to improve yourself. But hypertension is probably one of the most common things that we see. We also promote huge amounts of cancer prevention. So depending on age group, it would be mammograms, gynecological examinations, colonoscopies are huge. The recommendation now is to start your first colonoscopy at the age of 45, not 50 anymore. You also want to check your stools for blood once a year through your physician, which is done quite simple. And there's also bone densities for people postmenopausal, for ladies postmenopausal. And there's a whole host of other things. High cholesterol is something that we very actively screen because high cholesterol can lead to premature atherosclerosis, heart disease, and stroke. There's a whole host of things that we've been discussing. And then, of course, you have your patients who do a lot of smoking. Smoking is extremely deleterious to the body. There's no way of getting away from that. And we want to try to get patients to quit smoking and change their lifestyle before they develop permanent emphysema. Emphysema is notorious for just worsening. Even after you quit, it just progressively gets worse, and that becomes a huge problem.
As a physician, and you're growing up, of course, you knew that you probably did some things that weren't exactly appropriate. How does one really adhere to all this? And there's a lot of things you've talked about today. And before you answer, let me just tell everybody you are listening, to this very wise physician, Dr. Kevin Inwood, and he is with Healthy Partners. And Healthy Partners, if you'd like an appointment, it's 561-418-6200, 561-418-6200. And Healthy Partners is quite a company that you'll be able to get a lot of information from. You can find Dr. Inwood there, and there are other doctors, of course, but why don't you go ahead and continue that? I just want to make sure everybody knows how to get in touch with you.
Yes. So what was our question?
No, the question was, how did you get people to adhere to the things that you know? How did you change if you had any bad habits?
So, Anita, here's one very funny thing. I get made fun of all the time because I never smoked, I'd never done drugs, and I'd never even drank alcohol, and I don't drink caffeine. Even during residency, I never drank caffeine. I was the exception to the rule. However, it's paid off for me. So when somebody looks at me and goes, well, Dr. Inwood, didn't you drink? Didn't you smoke? It's very difficult to stop. And I go, well, actually, I never started. So therefore, it's not difficult for me to stop. And I try to promote, especially in the younger population, to not get started in the first place. Because if you don't go in the ocean, you're not going to get bitten by a shark. Okay. So I try to promote that. But then we have the people who have started and have done it. And what I try to explain to them is, let's not just stop everything cold turkey, because cold turkey doesn't work. Let's do something where we can come up with a plan or a program with sheer numbers of reducing alcohol beverages on a daily basis, reducing your caffeinated beverages, even reducing your smoking, and then some of the other things that we can do. There's certain types of medications that help promote the reduction of smoking, but it does require some willpower. But I think that if patients see somebody who's willing to help them and give them a reasonable, not an unreasonable plan, then I think your success rates are higher. And what I also do is I'm a big proponent of telling patients, I want to bring you back. Instead of telling you to come back in 6 months, I want you back in 8 weeks. This way, you're going to show me how much weight you've lost in 8 weeks, or you're going to show me how much you reduced your amount of cigarettes you smoke in a day. And then they have an incentive because they know they have to come back. And remarkably enough, you would expect that a lot of these people would cancel their appointments when it came time, but they come in. And if they were not able to be successful, they come in anyway, which is fantastic. And then we try to work on another plan for them.
I love this conversation because it's a lot of doctors are not doing this. I mean, it's unfortunate they're either too tired or whatever they're doing. They didn't have what you had when you in your body, your genes. So it's lovely to talk to someone like you who's so caring, and you do understand people like, people who do have various situations, and you don't just discount them, but you work with them. And that's, a physician, as you are, I think, deals with psychology. As you know, you deal with the human force in that person. And if you talk with them and study them, you can help them, and they know that.
Yes, and that brings up another great point, because we do have a lot of mental health issues. We have a lot of depression and a lot of anxiety, especially what's going on in the last 2 years in this country with COVID-19. It has really stressed a lot of people out, especially the older population who traditionally have retired and their favorite thing to do is to travel or see family. And it's been taken away from them to a certain degree. So we have to deal with psychological issues in addition. And the most important thing is you have to be proactive as a clinician to ask the patients outright, have you been feeling depressed? We do depression screenings on almost every visit when a patient comes in.
Oh, excuse me, what's a depression screen? I don't even know that.
So it's called the PHQ, and you ask certain questions to the patient to see if they test positive for depression. And there's different questions you ask them, but I don't need a depression scale to look at you and say if you're depressed or not, because just in a few minutes of an interview, I can see what your mannerisms are. I can see how you're talking. I can see some of the things that you're saying, and I would understand that. Are you having depression? And a lot of times they'll say no. You go, come on, you can tell me. And they'll go, okay, well, I've been depressed. And if they meet the criteria, we talk to them about the different modalities that we can do for anxiety or depression. I don't like to push medications because I don't want anybody having any issues with anti-anxiety medications, because that becomes another problem. So we try to develop certain therapeutic lifestyle changes regarding the environment, avoiding certain things, finding new hobbies. I don't care if it's sitting on your patio and knitting in the evening, anything to help take your mind off of it. But usually if somebody recognizes they have a problem, it's much more easy for them to deal with it.
Wow, I just love talking to you. I mean, usually, these interviews go on and I'm wondering, what am I going to say next? But with you, it's just listening to all this good, wise information. Well, their Healthy Partners very lucky to have you. And you sound like you're happy to be with them because they're allowing you to do what you want to do this way. And that's what a really good physician does. And I am happy really that we got to talk to you. So, but I'm not finished. I just wanted to ask you a few more questions about this. Do you know that when you probably know this, but an older adult, when they think they're going to the doctor, they spend that whole day in the morning or the night before getting all fixed up. It's like they're going to a party and they want to impress you as a physician. You know that. And that's why when you ask some of these questions, I feel wonderful because I've been with my mother when she's done that. And I know she doesn't feel wonderful, but she wants so much for you to like her and to know that you're doing a good job. Isn't that funny?
My favorite thing is when a lot of the ladies come in, I don't care what age, they get done up. And I always tell them you're doing it for me. And they start laughing. And if there's a relative there, they go, she is doing it for you. She doesn't want me to say anything, but yes, she did her hair just for you.
Right.
And it's a wonderful, wonderful compliment to me that these ladies just want to look nice for me. But that still does not change the fact that I have to address their issues and make sure that they're doing okay. And a lot of times we will ask family members to come in, as you just mentioned, for example, if you bring your mom in, because you can give us more insight into what is truly going on with that particular person. And it doesn't mean we're going to flood them with medications and all these testings, but it's a conversation we have to have. And then if depending on the patient's level of their cognitive abilities, because a lot of patients come in with dementia, that's a completely different bird and a different subject altogether. But if they come in, they have most of their faculties. If somebody's talking to them with respect and giving them some ideas and saying, hey, again, I'm bringing you back in a couple months. I want to see how you're doing. You'll bring your daughter in with you and we'll discuss anything needs to go on. I want you to keep a little ledger of things that are bothering you, make a little diary for me. It gives them an incentive to do something instead of sitting in front of the TV watching Family Feud all day.
Well, I wish the new young interns could hear you and that you could explain some of these things to them, because unfortunately medical schools aren't doing a lot of the things that I think they should. I guess they have a lot of things to cover now. They're all different ideas, but you are an old-fashioned, pardon my expression, old, but you're an old-fashioned physician with all the right feelings, which then help your patients. So it's not just you. I mean, it looks like you're happy being a physician, even though you've been practicing 33 years. This is something besides the selfish that made you start this. You certainly love that you chose this.
Yes, I do. And if I had to do it all over again, I would do the same thing. I would probably in all likelihood pick the same specialty, which is internal medicine. And I get asked all the time, when are you going to retire? And I look at them and I go, why would I? I work in air conditioning and I work around people that are wonderful. And it's, yes, you can have some significant challenges. They happen probably on a daily basis, but that's what keeps you young and keeps you thinking. And you're providing a service and you're making people happy and keeping them healthy.
Please don't ever retire. Don't do that. You're too good to do that. And I wrote a book called Live to be 100 Plus, and I don't think people should retire. Maybe they can change what they're doing, but just to stop working and then it affects them terribly. I mean, people are doing things that are just silly. I mean, they go to dinner or they go to the theater and that's it. You ask them which restaurant they went to. That's their biggest thing, when there's so many other things that they could do to help society. So what you're doing is extraordinary. And I'll just tell everybody, I hope that you didn't just join us, that you've been listening, but we're going to put this on YouTube anyway, so you'll get to see it. Dr. Kevin Inwood, and he is with Healthy Partners, which is a great organization, and you can reach them by 561-418-6200, and you can have a same-day appointment. They do physiotherapy. We even had a chance to discuss that. They have a 24/7 urgency line. They have transportation. Hopefully we'll get to have you on again, because I've got so many questions I never really had answered.
It was a pleasure. And I look forward to working with you and being interviewed at a later date. It was a wonderful experience.
Yes, thank you. It was for me also. And you should make sure that your assistants and all the medical practitioners along there with you are also appreciated, because they've been under a lot of stress also. And I say that as you sound like you would be a physician that does that, but I just hope that none of them are being taken advantage of, because a good doctor needs good support system.
That is correct. Everybody in the office has to work together. And if there's one weak link, it can affect the entire office. That is correct.
So Dr. Inwood, thank you very much. You can go back and make people happy, and thank you. And we'll talk to you again, I hope.
Thank you, Ms. Finley. You stay well and happy holidays.
Okay, the same to you. Bye.
Thank you.